Prevention of hepatic cirrhosis. Prevention is better than cure. Cirrhosis liver is a very fatal disease which can end in the death of the patient if it is not provided by the liver transplantation process, which is very costly and cannot be afforded by the lower middle class. So the preventive measures for the maintenance of the healthy life is necessary. As the main factor of the disease is excess of alcohol drinks, so it should be avoided. The motivative lectures, seminars, and videos must be conveyed to the public as an awareness campaign that this over drinking of the alcohol damage your vital gland of the body, which is factory for productions of protein, production of bile, for detoxification process, for metabolism of the necessary elements, the nutrients which is conveyed from the GI tract by the portal vein in the liver, they are further processed in this factory. When it is damaged by the cirrhotic process, mainly by the alcoholic chemicals, damage to the normal hepatocytes and the normal connective tissue of the organ. So first step is to limitize the quantity of the alcohol. Secondly, proper screening, annual screening of the every person for hepatitis B and C viral infection. It is very common in the world nowadays, and it is easily treated. If it is detected, antiviral, high potency antiviral drugs are available to eradicate this virus completely within 3 to 6 months therapy. Moreover, the spread of hepatitis B and C virus via sharing of the syringe, contaminated syringe should be banned. Unprotected sexual function without condoms, which is a protected rubber device, must be advocated to the public, which is a very cheap one, and it is a very protective measure to avoid the unprotected sex, which is the main spread of the virus. So these basic factors must be conveyed for public awareness to avoid the spread of the hepatitis B and C. Next is the vaccination, which is available for hepatitis B, must be injected to every person after screening test. Then there is obesity process, or the complication produced by the obesity, that is the state of hepatitis, that is the fatty liver. The liver which is accumulated by the excess amount of the fatty material, and that produces the inflammation of the hepatocytes. So to avoid this, we have to choose the diet which should be less or lesser in saturated fat. Similarly, we have to take low sodium diet to avoid the accumulation or retention of the water and electrolytes in the body, which are responsible for production of ascites and the pleural effluents. Similarly, we have to change our lifestyle, have aerobic regular exercise for at least half an hour. Brisk exercise is preferred, walking is preferred. Then is the balanced diet, which is essential for healthy weight of the person. The balanced diet or the healthy diet consists of a balanced amount of food, elements, that is carbohydrate, protein, fat, necessary vitamins, and the necessary minerals, which are essential for maintenance of the normal health. Excess use of purified water. Then maintain the mental health, that is to avoid the stress, depression, anxiety, the psychological complexes. Adopt the healthy, refreshing hobbies, which may be physical and psychological and the mental one. Study of cool literatures or the vision of the healthy or the positive videos, which are, the educational material for maintaining the health of the body. So these are the basic factors to avoid the cirrhosis of the liver. When it has passed in the final stage, there is liver failure, then we have to perform liver transplantation. That can be chosen from the live donors or the dead one, cadaveric donors. In live donors, a part of the lobe is transplanted from the donors into the diseased person or the person suffering from the liver failure. So it is a very scientific and latest surgical procedure which is now successfully performed nowadays all over the globe, but it is a very costly one. In order to avoid this costly stage and the treatment, we should adopt the basic preventive measures to avoid this cirrhosis of the liver.